The second video is another range of motion exercise. This exercise should be utilized 3 to 4 times a day in 1 minute durations, or as long as the patient's pain tolerance will allow. The progression to this exercise is active assisting exercise, as previously mentioned before, and is known as the rope pulley exercise. Please excuse my horrible miming techniques, but I couldn't find a rope on a pulley in time. Like the video before, this exercise is crucial in regaining range of motion through flexion, extension, abduction, adduction, internal and external rotation, as well as horizontal abduction and adduction. This third video concentrates on strength training and is known as a scapular elevation exercise. Strengthening the muscles around the joint, such as the trapezius and the levator scapula, is recommended in most, if not all, rehabilitation treatments. The exercise should be utilized 3 times a week with 3 sets and 10 repetitions, as long as pain is not intolerable. The progression of this exercise is the shoulder press, which also works the trapezius and the levator scapula. However, this exercise is more specific to the types of injuries that these types of athletes incur, such as the overhead exercise strength and treatment. This fourth video is another strength training video, and it's known as the scapular depression and adduction exercise. I chose this exercise because it works on the inferior trapezius muscle, which is another muscle that promotes the efficient rehabilitation of the shoulder joint. This exercise should be utilized 3 days a week with 3 sets at 10 repetitions. It is important to have a rest day between workouts to allow muscles to rebuild, especially when they're the muscles surrounding that injured joint. The progression to this exercise is another over-the-head specific type exercise, and it's known as the supine weighted ball toss. If you can, try to imagine that the ball is bigger and weighs a little bit more. This exercise is a polymetric exercise, and it promotes range of motion as well as strength training while being specific to certain athletes' injuries.